So medical laboratory technician career pathway panel. And as I mentioned earlier, our panelists, I will actually allow them each to introduce themselves, and then we'll move on to the questionnaire. So Carrie, if you would like to go first, and then Cameron, and then Stefano.
Sure. I'm Carrie Brophy Martinez. I'm the program director at Austin Community College for the Medical Laboratory Technician program, as well as the phlebotomy program. I've been at ACC now, I think I'm on my 16th year, and I've been program director since 2010. So I've been here a long time. My official degree, my bachelor's degree, is in clinical lab science, or back when I graduated, it was medical technology, but it's kind of all the same thing. And I have a master's degree in healthcare administration and education.
All right, I'm Cameron Norris. I'm the division lab director for St. David's HCA partnership in the Austin market. I've been with the Austin market and HCA for 6 months. Prior to that, I spent 5 years in the Denver market. Similar to Carrie, my degree is in clinical laboratory sciences. I had a graduating class of a whole 3, so I had very hands-on learning. And the great thing I loved about this profession was it gave me job security and the ability to travel. So I'm from Central Illinois, and I took my first job in Colorado. And we also offer varied shifts. And so right out of college, I moved to Colorado, loved skiing and snowboarding. I worked Thursday, Friday, Saturday night shift, and I'd go up to the mountains and ski and snowboard Monday, Tuesday, Wednesday, when everybody else was working. Since then, I've had different promotions in my career to be a supervisor, a chief medical lab scientist of a department, and eventually a director, and now the division director. So grateful for all the experience I've had along the way, and great mentors to help me.
Hi everyone, my name is Stefano. I'm a baby compared to the previous panelists. I'm a recent graduate from the UT Health in San Antonio master's program of medical lab sciences. I am certified by the American Society of Clinical Pathology, and I just work at St. David's in Austin, the main medical center.
Perfect. Thank you. Thank you all, and welcome today. I'm excited to learn more about this pathway. So we can move into our first question here. I know you introduced yourselves, but now let's go a little bit in depth. So briefly speak on your educational background, and you already mentioned your current place of work. So you can just speak a little bit about your educational background and how it led to where you are now. And we can stay in the same order. Carrie, you can go first.
Okay, well, I originally was actually going to major in marine biology, and learned very quickly after being at the coast for about a year that I couldn't live there permanently. So I came back up here to Austin and just happened to meet one of the great instructors in biology who told me about the world of clinical lab science. Never heard of it before. And so obviously I got my degree in medical technology and worked out in the field for probably 20 plus years. And then some opportunities came up to do some adjunct teaching here at ACC, which I decided that I was very interested in, because as bench techs, we do a lot of teaching with new employees and with students. And so I started working at ACC, ultimately getting a full-time position here. And so now my roles have changed. I don't teach at the bench, as we say now. I teach here in the community college, making great brand new professionals for our laboratory professions.
And yeah, we're grateful for Carrie and the work that she does with her team. And similar to Carrie, I was going to college to get a biology degree, thinking I wanted to do some research. Quickly into it, I learned I'd have to do 8 years of college and would rely a lot on research grants to get a paycheck. So luckily, I fell into an independent study with a professor in the clinical lab sciences department. And she opened my eyes to the profession and how it really is a way to help in the background. and fit the niche for the personality type I was and the way I wanted to help in healthcare. And so I have a 4-year degree, similar to what Stefano mentioned, with a certification from the ASCP is my background.
So I went to college at Texas State. I was majoring in microbiology. I was a pre-med student. I want to go to med school. Soon after, I discovered, for personal reasons, that that was not the career for me. So I continued my degree in microbiology, and kind of what Carrie mentioned. I had a professor that mentioned about clinical lab science. Um, and I got super interested in it. It was sort of what I wanted to do because working in a lab was my ultimate goal, but I had no idea that profession even existed. Um, and so I decided to continue my education. I got my master's in medical lab science at UT Health, and now I work at St. David's.
Perfect, thank you. I love hearing how when I meet someone who's in a particular field and then they say, wait, I wanted to do this first. It's very interesting how we could easily like change our minds. And then there's so many different options out there, you know, because thinking we want to do A, but we actually like doing B instead. So it's very interesting.
One of the things we see quite frequently here at ACC, about 50% of the students that are applying to our MLT program already have bachelor's degrees, usually either in biology or microbiology, and they're unable to find work because places like St. David's or other hospital systems are really looking for people that have laboratory experience and specifically clinical lab experience, which is very different from working, for example, in a chemistry lab or in a research-driven lab. And so this is very common for us to see with people that are applying to our programs. So it's a good way to kind of expand job opportunities for yourself and get employed.
Thank you for sharing that, Carrie, because I didn't even know there was a difference with laboratories. Honestly, I would have probably thought they were going to be all the same. So thank you for sharing that bit with us. Okay, so number 2, what are your daily job duties and how have your responsibilities changed since COVID-19? And third part to the question, what are your COVID-19 health and safety practices to remain up to date on new lab procedures? And Carrie, you can go first.
Sure. So I'm going to kind of address both as an educator and as a technologist, but primarily my daily job duties kind of cross paths here where you're teaching students, you're developing curriculum for students that have to be current. I can't teach stuff that we learned 25 years ago when I went to school because a lot of that methodology is now out of date. So again, that's really important. And it's important as a new technologist or technician to keep up to date as well with what's current in the field. Here at ACC, I manage about 10 to 12 faculty and also students and supply ordering. I do a lot of equipment maintenance, and that's a big part of a job duty as a technologist or technician is maintaining our equipment that we're running all of these lab tests on. My job duties have changed, not a whole bunch, honestly, since COVID-19, because safety has always been a very important part of our program with teaching emerging professionals. We have added a little bit more to our conversation here at the college related to what students can expect going out to clinical in regards to current COVID-19 requirements. And then kind of leading into the next question here, how I stay up to date is I'm involved with several national listservs, both on an education side and on a clinical lab science side, where these discussions are being held daily about what's being done in labs and educational facilities. We are always reminding our students to wash our hands or wash their hands, wear their mask, and social distancing. And finally, kind of mentioned this already, but keeping up to date with your journals, because those are going to list new and upcoming trends. specifically, like if we think about the Delta variant, some of that information was coming out very early in some of our journals about we saw this new emerging strain, and then later that was labeled as the Delta variant. So it's really important as an educator, keeping your finger on the pulse of what's going on out there, because we're sending students out for both clinical and as graduates, and they have to be ready to know what that current responsibility is going to be.
Thank you, Carrie. In my role as the division lab director for Central and West Texas, I work with all the facility lab directors at our 8 sites. So we have 6 in the Austin area with the St. David's partnership, and 2 in El Paso, which are fully HCA, Hospital Corporation of America. And throughout that, I work to oversee operations, look at our equipment. Like Carrie said, we're trying to stay at the cutting edge of technology. So we're looking to upgrade our instruments and be sure we're able to prioritize testing and give the right test at the right time for our patients. How have my job responsibilities changed due to COVID? I remember March of last year talking with my microbiology supervisor and just telling her, this is something you're going to tell your grandkids about. When we got the first Abbott ID Now to validate and be able to detect COVID to keep our patients safe in our hospital. And it's just very meaningful and powerful to be able to do that so quickly with the technology we had. And so now we run in the Central and West Texas market about 6,000 COVID tests per day. So those were tests that we were not running before the pandemic started. So we've had to pivot our staffing models to accommodate that extra workload that we were not seeing. I also partner with public health authorities to track, like Carrie mentioned, the Delta variant. We started doing that back in the spring to have it identified and prepare ourselves for this surge.
Awesome. Again, kind of like confirming what Carrie and Cameron are talking about. With COVID, I feel like a lot of the job responsibility comes from the fact that there are turnaround times that we have to meet when reporting COVID-19 results. So being an extremely high volume testing that we receive daily, we have to prioritize those tests, especially because for the Abbott ID Now, which is an instrument that detects COVID, we have around like an hour from the collection time that the swab was collected to report the result in order to provide accurate results. So we have to manage to add this new testing into a lab, and all the other tests that we keep on doing are not slowing down. It's still going at the same pace. So since COVID-19, I guess my responsibility is to be even more careful about turnaround times in order to provide those test results. But my job duties being strictly a bench tech, like Carrie said, there's a lot of instrument maintenance and troubleshooting that we have to do. All these different samples that come in, not all of them require the same level of attention. So you have to make sure that the instruments are working effectively. We run quality controls for our reagents and our instruments. And yeah, we just follow the turnaround times to help in the diagnosis of diseases.
Yeah, and I'll just tack on to what Stefano said. Really, nurses and physicians rely a lot on us. The ACP has quoted 70% of diagnosis comes from the laboratorian. So that means without us in the lab looking under the microscope, or like Stefano mentioned, running the COVID-19 test, we're not able to give them the positive COVID test or detect a cancer or let a patient know about diabetes. many different diagnoses.
Perfect, thank you. Oh, Carrie, did you want to add anything?
Well, I just wanted to say one other thing about our field, because not a lot of people are familiar with our profession. We typically, historically, have been very introverted individuals, and labs generally are way out of sight of public eye because we're dealing with biohazardous materials and these pieces of equipment, which are humongous. And so they're usually in the basement of hospitals or in a ground floor. And one of the things that I really like to emphasize that people that are kind of looking at our program or at our profession is, especially if you're a person that likes to tinker with things like electronics or automobiles or that sort of thing, the lab might be a great place for you to come because a big chunk of our work is automated. And these instruments, they're just like maintaining a vehicle. They have to have daily maintenance, they have to have weekly maintenance, monthly maintenance, and we're responsible for doing that. And so if you like to try to problem solve and troubleshoot, that's one piece that probably a lot of people don't realize. That's a big part of our daily job responsibilities that might be attractive to some people that may not really know that about us. They probably know we test blood and other kinds of body fluids, but they may not really make that assumption or that jump that we're also the ones keeping our machines clean, keeping them running. So I wanted just to emphasize that point as well.
Yeah, thank you for sharing that. That there's more to just testing and running samples and things of that sort. Okay. So for our next question, what advice would you give high school students? We may have a few high school students on the call today. So what advice would you give high school students to prepare for a career as a medical laboratory technician or a medical technician? Briefly, we already answered this one, but feel free to elaborate more on it if you'd like to. You can speak about your experiences that led to where you are today.
Well, I assume I'm still going first. So, how I would answer that is get your information now. Start doing research now. Many programs have information sessions that are done online that you can get information about the profession, about the requirements to apply to the program. And one of the things that I would do as a potential student is advise them to not only have your now goals that you're going to list out, but your long-term goals. Um, a lot of students really aren't, especially too, depending on where they're coming from geographically, they may want to, we always want them to set a high reaching goal, definitely. But let's also think of something that's attainable today. Many students may or may not be ready to be a neurosurgeon in the next 2 years. Start something small, do a medical assisting program, do a CNA program. Hey, come do my phlebotomy program and really figure out what you like about healthcare and where you want to be. In the lab, we don't have a lot of patient to patient interaction. Like I said, most of our interaction is with instruments and our medical providers, our physicians, our nursing staff. And so being able to set those different types of goals is going to be important. And start your research now. Start looking at information because many of the high schools that are in our greater Austin area do partner with us with certain kinds of programs here at ACC. And that's a really good way to sometimes even have a lot of your courses paid for while you're in high school. Free classes. That's awesome. So, and then also be thinking, do you plan to work while you're in school? Because if you need to work to support your family or to support yourself, maybe something more like a community college environment might be a better fit versus a student that might have a scholarship that may not have to have the pressure of the money, right? The money piece, and can go to a 4-year college. I always think it's a really good idea to maybe start small and then kind of further develop your goals towards your long-term goals. I was one of those people that started as a phlebotomist. Even to this day, I don't even know how I fell into this job, But it was one of the best jobs I had because it's kind of what helped to really form out my mentalities of going into the laboratory field. What would be the expectations? Could I handle sticking needles in people? We don't do that all the time on the medical lab technician side, but sometimes you do have to, especially if you're working in more of a rural setting. So that would be my advice.
Yeah, I'd say if you're in high school, focus on your biology and chemistry, getting a good background knowledge there. And the profession Carrie alluded to, we are more scientific introverted. I'll claim that for myself. And my wife is a nurse. She's more extroverted. She gets energized by being at the patient's bedside and helping families, where me, that's more exhausting. And I like to work on the instrumentation and look in the microscope and help in the background. So that's something I always differentiate. Not that we're all introverted in the lab. There's definitely extroverts as well, but more that sentiment in the laboratory. The other thing I would encourage you to do, it's harder now with COVID, but I'm looking to build this in our Austin market, is just volunteer program. So maybe you could help out in the lab by receiving the tubes we get and seeing the different specimens and delivering them to the different departments. Because the laboratory is a myriad of specialties. We have hematology, the study of blood, where we're looking under the microscope, chemistry, where we're getting you the cholesterol results, microbiology, where we're growing the organisms, blood bank, where we're giving out life-saving blood supplies, platelets, whole blood, helping with surgeries, massive transfusion reactions, and then pathology, where you're looking at the organs and tissues. So it's such a huge variability that you can have in the laboratory and look to specialize or be a generalist. And sometimes coming in and seeing it firsthand in a volunteer process, or even reaching out to myself, I'm happy to set up a lab tour. I love it whenever we bring high school students through the lab and expose them to the work we do, and they see the blood products or they see the tissues that we're looking for the cancers in. So really, get involved and look for a job shadow.
I don't have much to add to everything. I feel like their responses are so exhaustive. But definitely I encourage everybody to start researching about the profession. There are so many links and websites that talk about this profession and everything that it entails. There's a lot of research that talks about how this profession is going to grow, how much this profession is needed everywhere. And I would, if you're in college already, I would start maybe taking even advanced classes that can, I know some of the classes that a lot of programs have some prereqs that you have to fulfill. But for example, my program didn't have an immunology class because immunology was part of the program, but I had taken it in college. And when I got to the program and it was a lot more MLS driven, it helped me a lot to understand what was going on. And so it was kind of like I don't know, like an advanced class for it. So yeah, basically just study a lot, volunteer, get yourself out there in the medical field and explore what part of the medical profession you like and you want to pursue, for sure.
Perfect, thank you. All right, we have 2 more questions. So go ahead and feel free to start ramping up your questions that you guys have for our panelists. All right, and for our next question, I guess, Carrie, this is probably more so for you, but Cameron and Stefano, definitely feel free to weigh in on this as well if you'd like to. So what can students do now to prepare for the MLT program at ACC? And how rigorous is acceptance into the program? And what skills should students possess to help with their acceptance into the program?
So one of the things that a high school student can do today is they can go on to our webpage that's off of austincc.edu and just type in the search box MLT program, and it'll take them right to our webpage. And we have a bullet there that talks about information session. The information session is done 100% online. It talks a little bit about the requirements just to apply to the college. As a medical health professional, no matter our student in any of our programs, students have to submit things like criminal background checks, drug screens, TB tests, physicals, all these sorts of things. And so it lets the student know that those requirements are going to be needed and kind of checked off, in the future. And that information session will tell them quite a bit about our profession in general. Cameron mentioned some of the different discipline areas: hematology, chemistry, blood banking, microbiology. So we highlight these different subject areas to give some students some idea of what is coagulation. Well, that's a study of how the blood clots, but what does that mean exactly? So that's one thing they can do today. And we actually get some of their personal information, like their email, their name, and then we reach out to them to schedule an advising appointment. So although they're just in high school, they can go ahead and start laying the groundwork of what specific biology classes are they going to need. We require ethics. Is ethics something that they could take in high school and get college credit for, which is very possible nowadays? So there's a lot of classes that they might be able to kind of mark off their list before they even graduate from high school. We have new cohorts that are accepted into the MLT program annually, so once a year. Typically, we have about 35 to 40 applications for about 24 slots. We teach our program on 2 different campuses. We have one in Round Rock, and we have one, what's called at Eastview, which is kind of East Austin, not very far from downtown, kind of between downtown and the airport. And so we're very close to many different schools and many different areas. So we have 24 spots. And the best types of skills that students should possess: number one, time management. Time management is super important as a student and as a graduate. And multitasking. I see Stephanos kind of smiling because he knows exactly what I'm talking about. We have all different types of specimens that come into the lab during the day. Some of them have to be handled stat, like probably most of the COVID testing now is being handled stat, spinal fluid analysis. And then we have other kinds of tests that don't need to be handled stat. So students and graduates have to kind of figure out that time management piece. Study skills are extremely important. We see students that still don't really understand how to study effectively. So we're trying to ramp that up a little bit more in our program to help address those issues. Organization, patience, very important. Attention to detail, I noticed, was one of the things on your list as well. We're often looking for a needle in a haystack in the lab, or looking for that one little piece in our machine that seems to not be working. And so having that attention to detail is very important. So those are be my highlight study skills and skills that students must be able to possess.
Yeah, I think Carrie really covered it. I'll just throw a plug for soft skills. You're on a team with, probably 60 other medical lab scientists. So not only are you interacting from shift to shift, day shift to evening shift to night shift, but you're also going to be on the phone with doctors, translating results, nurses. You're going to have to clarify lab speak to a nurse or a doctor. So just having that professionalism and skill set to be a good team member and communicate effectively to others that may be outside of our audience is a great skill to have.
Perfect, thank you. Stefano, if there's any skills you would like to add that you think students should add, you're more than welcome to do so.
A big thing I think is also patience, a big amount of patience. You are working with a lot of people, and a lot of people have a lot of different feelings about things. So you also have to manage that side of healthcare. Like Cameron was saying, like communication with doctors. You also want to make sure that um, is a specimen contaminated, because all these values are whack, and that's not very common. You always want to be communicating with what's going on with in a situation, and also you have 100 other things that you have to do when you're talking to the doctor. You have ER that's pushing so many samples out in the lab, so you do have to have a big amount of organization and organizational skills, technical skills, and critical thinking skills that will eventually like lead you into becoming a good MLS for sure.
Perfect. Thank you. Thank you all. All right. And so for our last question, it's another three-part question. So definitely take your time with answering it. So when you work in a high volume lab analyzing data and samples, what do you do to prevent errors in mixing up blood samples? And what are the lab practices procedures? And what is one complicated sample that you had to analyze, and what made it difficult? Or basically, in other words, what is a challenging sample that you had to analyze? Carrie, you can go first.
Sure. So I'm going to steal Cameron's term of lab speak and give you some lab speak. So in the lab, we have three different places that errors can occur. Pre-analytical, which means the problem or the error is occurring before the analysis occurs. So basically before the sample gets into our labs. We have analytical errors, which are errors that occur during the testing component of testing. And then we have post analytical errors, which are usually things like transcription errors, looking at a ticker tape of results and typing in that result into the computer. And so with your particular question, this is an example of a pre-analytical error where you might have a mix-up of a blood sample. And it really all starts at the bedside with our phlebotomy staff or with nursing staff, if they're the ones drawing the blood, that we want to make sure that samples are being labeled at the bedside or in the presence of the patient, where we are confirming that this is Shannon and this is her date of birth, and we're putting that label on those correct tubes, and then those are being sent down to the lab. We don't ever label specimens outside of the patient's room, because that's where you have the opportunity for mistakes to occur. Those are really the big ones that I would say are the important things. I would say one of the most complicated samples we deal with in the laboratory are patients that have acute leukemias. When a patient has an acute leukemia, they can have white blood cell counts that are extremely high. And when you have these very high white counts, it tends to skew other lab results, especially in our CBC, which is our complete blood count, such as our hemoglobin and hematocrits. And so they can be very difficult to work with. Even though our instrumentation is quite advanced, it can still throw our instruments a little bit of a curve. So we have manual methods that we sometimes have to revert back to, in essence, verify what our instruments are giving us. So that's just one general example that I can give. I'm sure Stefano will have a better example since he's currently working in the lab, but that would be my 2 cents there.
Yeah, I'll just share, I mentioned the right test on the right patient at the right time. In the laboratory, we don't have the benefit of having, 50 patients in the lab. We have their samples, which we view as the patient. And we take it very seriously to be sure we're following safety protocols. So one thing we do is we give them an accession number, and we use barcoding, which allows us to have virtually error-free work. And we do checks and balances with quality controls on our instruments and calibrations every 4 to 8 hours, depending on the platform. And then we have a management structure. We have supervisors, we have lead technologists, we even have managers that help do checks and balances to be sure reports are accurate, New hires are getting trained appropriately, signed off on competencies. So we do have a good checks and balances to reduce as many errors as possible, but Carrie gave a great breakdown of the three major ones. A complicated case that I dealt with, I remember young in my career on the night shift, I saw something I hadn't seen before in a microscope looking at some blood, and found out that it was malaria. And so I, as a young student, couldn't just verify that and call the doctor. I had to get confirmation from a supervisor, and then they did a further workup with a pathologist to review the specimen before it was reported. But that was, rewarding. Like Carrie mentioned, we're looking for a needle in a haystack, and that's an instance of a rarely seen, at least in the United States where we're at, to diagnose malaria. But then having other experts for me to work with to confirm it.
I can definitely say those are really good examples. Those happen daily, depending on the lab where you work at. But well, malaria not so daily, but that's always interesting to see. And you obviously want a pathologist to confirm. Those are the very rare cases that you might be able to recognize, but sometimes they're particular. I would have to say, to prevent errors, a rule of thumb is always check the patient identifiers, always double check what you're looking at, the tube, the name, the date of birth of the patient or the medical record number. All those things are always helpful into preventing mistakes. And I would say most of the errors are like pre-analytical errors, like Carrie was mentioning. And although errors occur always all the time, it happens that you make mistakes. We're all humans. For a very complicated sample that I have, I always find lipemic samples, so it'd be really hard to deal with. Lipemia is high fats in your serum. So you will get this when you centrifuge tubes, especially in chemistry, you'll get a serum that looks like milk. And that interferes with all the instruments like luminosity and all the values and parameters that it uses to analyze the sample. So for example, the electrolytes won't pop up correctly. So you will have to go through all these processes and procedures to make sure that you reduce the fat content in the serum to provide that accurate result. There's a lot of patients that even incomplete blood counts will get, for example, like a low white blood cell count. And when you have to review the smear to do a cell differential to evaluate the number of cells and which kinds of white blood cells the patient has, you have to do procedures. I don't want to get too technical, but you have to do a Buffy smear, and you have to try to get as many cells as you can. And sometimes it's almost impossible. So all those little variations that you always get daily can happen, and you have to be able to solve those issues and either get a redraw or talk to the nursing staff and the doctor. And sometimes there's not too much that you can do in those cases. And I also did want to talk briefly about blood bank, because I feel like not much of it has come out. But transfusion services is something that we do, and sometimes we'll have massive transfusion protocols depending on the lab you work in. And those are always complicated to deal with. You have to prepare a lot of blood products imminently, like the patient is dying, is bleeding, and some of those samples can be complicated. I had one last week where I had to constantly give out blood products, and I had someone help me because sometimes it's hard to deal with that. So yeah.
Great, thank you. Thank you all for answering that three-part question for us. And now we have a little bit of some fall updates, and I'm actually going to turn it over to Ashley so she can give us a few updates.
Perfect. Thanks, Shannon. I just wanted to give everyone just a quick update. I know I sent out an email, but I just wanted to let everyone know that we are not holding clinicals this fall for any of the students due to COVID. We were very close to getting them started back up, and then we had the outbreak again of COVID. So again, I would like to say we are hopeful that we will have clinicals in the spring, but at this point, I have stopped predicting anything that may or may not happen with COVID absolutely at all. So keep you guys posted. Obviously, we're still working with the hospital systems to keep track of everything and what their availability is and the safety for students. Ascension has put out a notification that they will be requiring full vaccinations for anyone doing clinicals moving forward with the deadline of November 12th. So any high school students that, any programs that typically did clinical placements at Ascension facilities, I would anticipate that that is going to be a requirement for high school students going forward as well. So if you did want to start looking at your processes for, tracking that and making sure that you have all the documentation for students, it'd be a great opportunity to go ahead and kind of work through that system and what it could look like at your schools moving forward, because that will be one of the. At this point, St. David's is not requiring clinicals, but that or vaccinations, that could change between now and then. We just don't know. Everything kind of changes day to day, unfortunately, right now with COVID. So if you have any questions, please feel free to reach out to me about that, and we'll keep you posted on spring clinical placements and the opportunities for that. I also did want to just make a quick announcement that the Executive Council for HVAC did vote to merge with Central Texas Healthcare Partnership. Basically, what that means for the high school programs is absolutely nothing. We will continue to do our K-12 work groups, continue to give updates on clinical placements. All of those things will stay the same. Now my emails will just say Central Texas Healthcare Partnership instead of HVAC. So let me know if you guys have any questions. Happy to help any way that I can. Thanks, Shannon, for the opportunity to give a quick update.
Yes, of course. Thank you, Ashley, for that. All right, so if we don't have any further questions, we're going to move into closing out our presentation. So I just included a few links on this slide for you all. So some resources. As I mentioned earlier, our Climb the Ladder CTX website is our microsite. It has a ton of resources about different career pathways, resources about our teacher externship that we did this just this past summer. And then thank you, Kay, for sharing your link for ACC MLT's program. So like I mentioned earlier, we will be sharing this presentation out with everyone on this call, so you'll have access to all the links, the videos, and everything that is in this presentation. To close out our presentation, I'd just like to put our social media card again. So if you haven't had a chance to follow us, please definitely go ahead and do that now. And just to make a little note for any of the ISDs on the call today, just as a reminder, if you do need any help with presentations in your classrooms, if you need any guest speakers, if you need any sort of workshops done for your students as we get used to being back into the schools, definitely send us an email. You can email us at careerladder@wfscapitalarea.com, or feel free to email us at our personal email address, and we'll be more than happy to help you out. And I just want to thank everyone for sticking on the call with us this morning and through the afternoon. Thank you for joining us as we kick off our healthcare webinar, and we will see you all next month. And thank you to our panelists for joining with us. I learned so much interesting facts that I didn't know before. So thank you all, and we'll see you all next month.